Coronavirus is sweeping across many countries and it's spreading so quickly within the communities. Health authorities have asked people to take precautionary measures to tackle this problem, and international leaders are urging citizens not to be panic. Here we have Dr. Emmanuel with us to answer some common but important questions related to coronavirus. Thank you very much, Dr. Emmanuel, for your time. First of all, tell us how can we differentiate between common flu and coronavirus? Like, what are the symptoms and how can someone know if they are infected or not?
Okay, well, thanks for the opportunity. Actually, I'm a family nurse practitioner, and how somebody can know are the symptoms. The symptoms usually are just about the same with a flu and a coronavirus. However, the difference or the main difference is somebody who has a coronavirus usually present also with a complaint of shortness of breath, which people who do not have coronavirus or who have a flu don't usually complain. So the symptoms are just about the same thing. You have malaise, generalized pain, fever, some cough, just respiratory issues. However, again, the difference is, or the main thing people should look out for, is somebody who is also complaining of shortness of breath.
Okay. People are generally confusing coronavirus and flu together. So, if a person has flu-like symptoms, what should be done in first place?
If somebody who has a flu-like symptoms, certainly seek the advice of their doctor. They usually test for flu. It's usually flu A or B. If any of those are positive, they are usually treated with some antiviral medications. And then just take some precautionary measure, get some rest. Fluids are well advised, and just get some rest.
Okay. Doctor, tell us, does wearing mask help against coronavirus?
Wearing masks usually they can be helpful, especially somebody who is exposed to coronavirus. Yeah, it certainly can be because those things can also be translated or transmitted by droplets. So a mask is usually recommended, especially to isolate that person from the community and the community also to be protective from such a person. I'm holding in my hand here, this is an N95 mask, and this is just a common surgical mask.
Okay.
Yeah.
So, can you please elaborate which type of mask should be used? What is the difference between surgical mask and N95 mask?
N95 masks are usually just those that helps to protect more against droplets. The surgical masks are usually the ones that pretty much everybody can use. The N95s are more protective. They are more airtight compared to just the regular surgical mask.
Someone tests positive for coronavirus, what that person should do in first hand?
If somebody tests for coronavirus, it's highly advised that the person should isolate themselves. You can stay home, certainly call for assistance. Definitely, if the person tests positive, usually they're tested in the hospital or in a healthcare setting where that person will now be isolated from the community and then treated or get some kind of help with the symptoms.
Okay, how can we prevent spread of coronavirus in community? What role citizens can play more?
The citizens certainly can help in the spread of coronavirus, and that is by, again, hand washing. It is highly recommended that people should perform hand washing, wash at least 20 seconds each time with soap and running water. Try not to, I guess, have a hand contact, hand shaking, things like that. In other words, you don't want to shake the hand of somebody who perhaps has been contaminated and then touch yourself. Yeah. So if the community can observe those kinds of things, in other words, try to distance yourself at least 6 feet from each other. So that even if the person is breathing towards you, you will not, the chances of contracting that is now limited.
Doctor, tell us who is more susceptible for this virus.
The people that are susceptible are usually like the elderly. Uh, the literature have shown that those that have immune compromised, people that have some kind of health issue that have their immunity compromised, or the elderly, those are more susceptible. Those that have other health issues, COPDs, for example, asthma issues, those can have more serious health conditions if they do contract the coronavirus.
Okay. Is it dangerous for a pregnant woman to get the coronavirus?
It is always dangerous for a pregnant woman to get any kind of virus. Certainly, they should try to stay away, even if it's not a coronavirus. Try to stay away from people that are coughing or have some kind of a respiratory issues or respiratory problems. Stay away from them. That will limit or minimize their chances of contracting coronavirus or any other respiratory issues. There are not many medications that are given to pregnant women, given to them while pregnant. So it is highly advisable that they stay away from, large crowds, especially those that have some kind of a respiratory issues, so they themselves will be protected.
With confirmed cases already in Houston, how are you prepared to deal with it?
Well, we advise our patients. We are ready for, an outbreak if hopefully not. But we do educate our patients, tell them what to do. Hand sanitization is highly recommended. Hand washing, again, is recommended. We'll screen our patients as they come. We do appropriate referrals. We are in contact with the local healthcare departments and the state and the federal government. The CDC is there. We can reach out to them by telephone if needed. So we are ready. We educate our patients, and certainly screening is highly important.
With no vaccine in sight, what kind of treatment is being given to the infected people?
Those that are infected right now, there are no medications that is readily available, at least that we know of. Currently, the management is just to treat whatever underlying problem that may be. People that have flu, for example, give them antivirals, or if somebody's having fever or shortness of breath, they can be supportive with either mechanical ventilation or some kind of oxygen to help them to breathe better. And of course, so just whatever a symptom that shows up with that infection, that person will be managed with that. It's just a supportive care at this point. There is no antivirals that we know of that manages or treats coronavirus.
Okay. Does the virus cause any kind of damage to the body? Because people believe if they are like diagnosed with the disease, they can die.
Well, the main effect of this problem is the lungs. It affects the lungs mostly. It damages the lungs, and because of the damage to the lungs, exchange of oxygen becomes limited, becomes a problem. Therefore, people becomes sicker because they can't breathe well. And that usually, if they can't breathe well, oxygen will not circulate well in the body, blood will not be moving around, and nutrients and things like that will not be moving around the whole body effectively, and that can really cause a serious problem.
Okay. Lastly, how does the virus spread, like coughing, sneezing, or shaking hand?
Yeah, all of the above. They can be spread by coughing, sneezing. So again, it's a respiratory issue. It's in the air. That's why it's advised that people stay away from each other, at least give a space of 6 feet from each other in conversations. Handshaking, yeah, again, it can be, you shake somebody who's infected, shake their hands, yes, you can, and then you touch your face, so the virus can then get into the system and get to the body through the eyes, the nose, the mouth, and so it's discouraged that way. But of course, if you do shake somebody's hands, just go ahead and wash your hands at least 20 seconds.
Okay, do you see any difference in the price rate before this disease?
Oh yeah, the price of mask definitely. We used to buy the N95s, about a box of them, maybe $20, $25, and the surgical masks are way cheaper than that, about $10, $15. Now the surgical mask, last we heard, is about $20 each one, and then the surgical masks have gone up also. Definitely, this has impacted the cost of masks. And the hand sanitizers also have gone up. In fact, we went this morning to look for them in the shelves, and we just couldn't find as much as we wanted.
So, is there any way we can make it easier for the poor people to buy them?
To buy them, I don't. The recommendation is for if somebody feels they're infected or they need help, seek the help of your primary care provider. People shouldn't go around and looking for masks or things like that. Definitely, if you run into them, that's fine. Just have them and keep them with you. But I think the first approach is just to seek the help of your healthcare provider. Let it not be the first priority just to go around town and looking for where to get a mask.
Okay, thank you very much for your time, doctor. Thank
It is
you.
my pleasure. Thank you so much for the opportunity.